So we know in this country that long-term care homes have become one of the tragic COVID-19 hotspots. In Ontario alone, some 40 residents of the facilities have died so far, and many of the workers in the homes have become infected themselves. The deaths have underscored the vulnerability of seniors in the face of the pandemic. Dr. Merrilee Fullerton is the Minister of Long-Term Care in the province of Ontario, and she joins me now. Minister Fullerton, thanks first of all for your time. I know you're very busy, and I appreciate you taking a few moments to speak with me. Have you been able to get a handle yet on just how many long-term care homes in Ontario have been hit with infections? How many homes are we talking about?
Yeah, at this point, we're considering one case an outbreak, and that would be either in a resident or a staff, and there's about 37 as of this morning. There are homes that are getting a handle on it, and they're being able to resolve the outbreak, and so the number is continually changing. But as of this morning, about an hour ago, my understanding is it's 37. But I want to give you context, which is we have about over 600 long-term care homes, and that's not including retirement homes here in this province. And so that equates to about 5% of homes right now. But I'm looking at Quebec and understanding, are they ahead of us? Did they surge ahead of Ontario? And understanding that we have to do everything in our power to keep COVID-19 from getting into our long-term care homes. And that's why we initiated very stringent measures weeks ago, and continue to work with the Chief Medical Officer of Health.
Let me get into that. So what is it, when you look at Quebec, what are you seeing?
Well, I'm seeing massive numbers of homes affected. They had their spring break about a week before we did here in Ontario. And there is some lag time, and the Chief Medical Officer of Health has pointed this out, that the movement of people, a couple weeks before is often reflected at that time, 2 weeks later. So there's a lag time between when there is exposure and when the numbers start to go up. So keeping that in mind, 95% of our homes right now, our long-term care homes specifically, do not have an outbreak. But the ones that do, we're making sure that we have Chief Medical Officer of Health, his directives, the public health leaps into action at that point as soon as there's a first case, either in staff or in a resident. But even before that, and I want to emphasize how important it is that the community understand how critical it is that they have a role. So we must stop the spread from the community into long-term care. And that's why we created the essential visitors only policy weeks ago. That's why we set up the active screening. And staff are being screened when they go in and also when they leave at the end of their shift for symptoms, with temperature monitors. So infection control has been upped. We have, in terms of personal protective equipment and staffing shortages, we're actively monitoring that. We're aware of the homes that are having difficulties, and that's on a daily basis and a twice daily basis in some cases.
Okay, so let me ask you there. So let's talk about the staffing. That is one of the biggest challenges, right? And so it seems to me there's this double-barreled challenge you have. One is to try and staff up personal support workers, but at the same time, a lot of personal support workers work at more than one facility. So the challenge is, how do you get more workers, but also this challenge of trying to make sure that they aren't moving from one facility to another. How are you dealing with that?
So important. And so right from the beginning of all of this, we've been in constant contact with our long-term care associations and really understanding what they were working with on the front lines. We already knew that there was a shortage of PSWs at the point there was a dedicated ministry for long-term care. And that's something that we've been actively working on since last summer. But this is a whole new reality and an emergency situation. So we created emergency orders to allow our long-term care homes to act and be flexible in terms of staffing. We want to create a safe environment for our staff, and that means being able to support them with additional workers. And so we've taken those measures. In terms of the multiple homes issue, we've addressed that as well. We can't force people to work only in one location, but we can certainly encourage that. And we take our directives from the Chief Medical Officer of Health, and we're taking measures to really encourage our long-term care homes to have their staff working in one home only.
So when you talk about I think I heard you say relaxing perhaps some of the requirements to try and hire more workers more quickly. What exactly have you done that would allow these homes to get more staff?
Yes, well, we want to make sure that everyone understands, our homes and the public, that the standards will still be maintained. The flexibility will be in, for instance, the redeployment of staff within the home to certain areas that might need greater attention. It includes being able to bring in people that would be trained to help a PSW. So to be able to provide the services that the PSW doesn't need to do. So whether it's portering, whether it's assisting with feeding, but they would be trained in that feeding. So we want to make sure that our PSWs and others who are on the front line do not burn out, as staff may have to self-isolate because of exposures to, one case in a long-term care home, which we call an outbreak now.
Okay. Let me ask you.
So we have to address that.
Okay, you've heard some of the criticism that the measures you've talked about today. Some people have suggested, look, you should have taken these sooner. When you saw what was happening with this virus in China, when you saw what was happening in Europe and the disproportionate impact on the elderly and on nursing homes, should you have moved quickly, more quickly? Should you have acted sooner than you're acting now?
Well, the directives come from Public Health, the Chief Medical Officer of Health, and we follow his directives. He has the evidence, he has the medical understanding behind him. And the public health units also are actioned with his directives. And so this is a situation where it's evolving. The world has never seen the likes of COVID-19. Our outbreak protocols were based on our best knowledge of influenza pandemics. This is a coronavirus, COVID-19. So really what happens is this has never been widespread in the world. It's a brand new beast. And so we're having to learn as we go. Even if you look at Italy and Spain and the US, I think there's a situation that this is, they call it a novel virus. It is brand new, and it is acting in a much more aggressive way than anything we've ever seen before.
All right. Okay.
Yes.
Let's end on this weekend. What's the promise you think you're able to make to the families of those seniors, mostly in the in the long-term care facilities? What's the promise you think you can make to them today? Because this is going to get worse before it gets better. Are you able to tell them, look, we think we've got a handle on the long-term care homes now, and we think we can arrest the kind of spread we've seen in the first few weeks?
Yes, and so our commitment as a government, as the Minister of Long-Term Care, is to the safety and well-being of our staff in our long-term care homes and the residents and their families. That is our commitment. We are taking every measure possible under the directives of the Chief Medical Officer of Health and his scientific and medical understanding of and how we can learn from every instance to improve everywhere what we can do to prevent COVID-19, not only from getting into our homes, but from isolating it in place and making sure every measure is taken that can possibly be taken.
All right, Dr. Merrilee Fullerton, Minister of Long-Term Care in the province of Ontario. Thanks for your time today. I do appreciate it.
Thank you.